I'm Dr. Troy Spurrill, and our podcast is Synapse Snips. Our podcast teaches people about how the body is supposed to work, basically how we were innately made. Have you ever wondered why you get headaches? Ever wondered why you wake up and you just, your feet don't work in the morning and they're achy, and then as you get walking, it gets better? Have you ever wondered why you don't remember your dreams? Have you ever wondered why you're gaining weight even though you're eating right, you're exercising, and the weight keeps coming on? Have you ever wondered why you're just feeling depressed? That's hard to get up off the couch. If you ever wondered about why you feel these things and why you're not just feeling right, listen to our podcast to get the answers. We get to the root cause and we tell you why. Make sure you're listening to Synapse Snips each and every week where we answer the questions that you guys have. Also, you can find us at officialsynapse.com. That's officialsynapse, synapse.com. Hello and welcome. This is Dr. Troy Spurrill and Synapse Snips, and today I'm pretty darn excited because we've got Richelle, our PA, the historic Richelle, who's working with spike protein injury and hormones, and we've got Bryanna, a special guest, and I'm really excited to dive in and just talk a little bit about what Bryanna does. I had the pleasure of meeting Bryanna, and Richelle joined us just recently down south in Atlanta. Down south for us in Atlanta, and that was at the FLCC conference, or the new name, IMA, and we'll go through all of that. So welcome, Richelle. Welcome, Bryanna. Glad to have you guys here on Synapse Snips.
Thank you, Troy. It's a pleasure to be here. I was so happy to connect with you and meet you finally. I've heard a lot of really good things from our mutual patients, and it was neat to connect in that space. So I'm looking forward to our conversation.
Yeah, awesome. Why don't we start with a little bit about just introducing yourself and what you do, and then we'll kind of take it from there. And I can't wait to dive into the fruit of what the IMA was all about.
For sure. Right. Well, I'm a pharmacist and I'm originally from California, but I took a very unconventional route getting out here to Texas and doing what I do today. So some stuff we didn't even cover, actually. I went to school out in California, did my undergrad there in kinesiology. I was a student athlete at UC Davis. I played golf and went on to play golf professionally. Ooh. That was like this whole other life before, right? Very, very different. But I went to pharmacy school out in Arkansas, and shortly before that, I actually lost my dad to prostate cancer. And I say that because, you know, just like all of our stories that we have, it's something personal that's happened to us that brings us to where we are today, that I think makes us really great at what we do, right? And it's a privilege and an honor to be able to sit with these patients, sit with colleagues like yourselves, and experience what our patients are experiencing. But that was a big thing that led me to pharmacy school. And I actually had a really interesting opportunity in pharmacy school to learn about pharmacogenomics, which tells us how the body utilizes our DNA as a very integral part of metabolizing medications. And that was so fascinating to me because I was doing research in the breast cancer space. So just from the beginning, although I went through a conventional training, I took a very atypical route to practicing pharmacy, because it didn't take me long, especially with some of my own personal health struggles, really bad H. pylori infection. That was not caught for quite some time. But when it was caught by a functional medicine doctor. I learned very early on why taking a root cause approach is so crucial for not just the healing of our patients, but for long-term success, because we see this yo-yo effect so much. But instead, we really want our patients to remain healthy and encouraged and to live their very best life. So fast forward to now, I'm a compounding pharmacist down here in Houston, Texas. Got here as fast as I could, as they say, right? And it's a great thing that we're doing. We specialize in bioidentical hormones and some of these repurposed drugs that I'm sure we're going to probably chat about today.
Oh, yeah.
Have a really interesting role in what you guys are doing as helping to complement the therapy and the approaches. And certainly for the past 5 years, they've become very relevant in patients' therapy. So I also do still incorporate some nutrigenomics testing into the approaches for my patients, because I think that's an important part of the root cause approach, and nothing really makes us more unique than our DNA. So why would we leave that piece out? But
I agree.
I enjoy the whole picture. I think it's so fun, and that's why I got really attached to you guys at this conference, and originally to Richelle, because you guys bring so much knowledge and passion and hope and encouragement to patients, and that encourages me as a fellow colleague. So I appreciate you guys for that. But that's basically what brought me to where I am today. It's we all have such an interesting, unique path, right?
Yeah, that's awesome. You should have led when we first met with the golf thing. I'm a golfer, so that's a big deal, actually.
Masters week. It's the best week in golf.
Oh, yeah. Well, you actually had one of the best compliments I've ever heard someone say when we first met, and you were talking about Richelle, and you called her we were lucky because we had ourselves a unicorn.
Oh.
I love that. So that's always going to be my little picture of you, Richelle. Now, is our unicorn. So most people here at Synapse know you, but can you just talk a little bit about what you're doing here at Synapse and your role?
Thank you. Yeah, so I'm a physician assistant by trade, and kind of like Bryanna, I started out in the traditional medical model for about 8.5 years. I was very hospitalist born and bred. So I saw everything from ICU to ER patients to just stable floor, what we call, your pneumonia patients. And that was really what I knew on trade COVID. And so those last 3 years, when I was in the hospital, I was taking care of a lot of the post-vented COVID patients. And that clued me into something's not quite right with the way we're treating people. And without getting into the fullness of that story, I started becoming a lot more curious about the scientific method, the process, where our data and our research was coming from. And I started taking a broader approach to full body wellness. And I think the American public was way more on top of this than we were at that time. And there was a full pendulum swing and a need for it to really blend all that we knew to be able to get people well. So I was fortunate enough to be able to resign and hang my hat in a camp with a physician who had the same beliefs and wanted to help people from a multidimensional, multifunctional wellness model that incorporates not only just the body, but our emotional health and, building back the immune system for a lot of people in a lot of different ways, because post-COVID, whether infection or injection, we fall into one of those two categories here these days. A lot of unique and funky unicorn things were arising, and we didn't have answers for them. And so we needed clinicians that were willing to bend the mold and were willing to lead the charge in being, restoring that scientific method to the people, which was getting them access to things like repurposed pharmacological drugs that were safe and vetted, that, Bryanna's team was helping us with. And then just finding new answers for new problems, which is a lot of what this international or IMA conference was about. And so that's where we all kind of came together. I think, Bryanna and I met at the first IMA conference. It was then at that time FLCCC. And it was like sisters is what it felt like. She had the answers to the problems I was trying to champion for people. And then I met Dr. Troy shortly after that into the year, and he had the machines that I was looking for to help capture these novel problems that his team was already on top of and moving the needle for without most of the world being aware of it. So it's been really neat, I think, just in this whole full circle moment to get us all together here to blend what we each uniquely know, what we each have individually experienced, and to find new answers together. And so that's what I do at Synapse, is I try to bring the worlds together to get patients the best care.
Mm-hmm.
Yeah, you do a really good job with it. And it is fascinating because COVID woke up a lot of doctors, a lot of people. And a lot of us had to kind of switch gears a little bit. For example, in my world, I've been in functional medicine for 30 years now, and we were pretty much all just very, very natural. We did not really use a lot of pharmaceuticals at all. And then COVID hit.
Right.
And I found myself needing the pharmaceuticals, needing ivermectin. I'll say it out loud and bold and proud. And it was something where it completely shifted my thought process. And then the completely bizarre happened, where all of a sudden we started getting people that were very like-minded from the functional medicine and very natural world, alternative world, and the traditional world. And we were having conversations, and we were all like-minded with our heart, but also we were seeing things the same way.
And so now we're seeing this beautiful blend of the two worlds colliding, where you've got these people looking for honest medicine, looking for honest healthcare, and looking for high integrity results, root cause driven type of solutions. And boy, oh boy, is it it's so much fun right now just to be a part of it. Yeah.
And I tell you, it takes a humble spirit too, to unlearn and to relearn. And I think I have found that to be very true of the people who are at the forefront right now from all types of clinicians. And so that's really neat to see, because I think we need humility to be able to ask honest questions and to be able to say, hey, we were wrong about this, and now we're going to do it this way. And honestly, I think the American public needs to hear that too, to rebuild some trust in the directions that we're going. But it's been creative, it's been humbling, and it's been, like you said, a whole lot of fun to meet people just like you guys and get together in this way.
Yeah, humbling's a good word, because that's why we get so excited when we run into a Bryanna or run into a Richelle, or we're going to talk about a few of the other doctors that were at the IMA. So let's just jump into that. So I'll bring up a little slide here with some of the featured speakers. But for those of you who don't know, the FLCCC, there's 3 C's on it. They literally changed the name because of that. I don't know what the last C is for.
It's frontline critical care.
COVID care.
COVID care. I missed the COVID.
See, Bryanna's got the answer.
Okay, got it. Well, they said at the conference there was too many C's, so they switched over to Independent Medical Alliance. I think I said international previously. It's Independent Medical Alliance.
Yeah, and I really like that name, because they are really setting the tone for a part of what our future healthcare system can look like. A lot of what we're doing at Synapse is to create, be a part of that new healthcare system model. And from what Bryanna is going to talk about with her facility, it's the same way. So very, very exciting. So let's just start with just what did you guys think of the weekend?
Yeah, I'll let you go first, Bryanna.
Well, over the past couple years, I think I've seen this conference change a little bit. There was more of a political twist than I expected. And let me preface that by saying that I'm seeing this from a different view, a different perspective, I think, than a lot of people there were, meaning that we are in the midst of a major historical political shift in time right now.
Yep.
And also many of us, like us 3 right here and several others in the room, have already taken the leap to go independent, to break off from conventional medicine, to be bold, to do things that have put other people's licenses at risk and have lost their licenses because they stood up, mainly talking about physicians. They stood up for what they believed was right, for pharmacists who stood up for what they believed was right, and filled prescriptions for ivermectin and helped people, yet were betrayed by the medical system. And so there are a lot of people that I spoke with that are still very apprehensive to take the leap of faith to get to the other side, which is where the 3 of us are. And so I think that political emphasis was important. From the clinical side, some of my take homes were that we were still really emphasizing the importance or relevance of metabolic dysfunction in our society, which that concept in itself has a lot to unpack, but it has complete relevance when we're talking about the development of chronic illness or development of cancer, or how a long haul COVID patient presents when they come in your office or they come into my pharmacy. So there was a lot of corroboration of kind of what we've already been doing, which is good. You always want to have some of that to know that you're on the right track. And, I also left with some questions, which I think is important, about what are we doing with this super elevated spike protein antibody level that we're seeing in so many people? How are those testing methods changing and evolving, and what's on the horizon? So those were my main takeaways. I definitely walked away with some questions, which I think we always do. We're always thinking about this kind of stuff, right?
Yeah. So for a lot of the people listening, there's a lot of people that are walking around with elevated spike protein antibodies. And so one of the things that I kind of took away is Dr. Paul Merrick, who really started the whole campaign back in the day with a lot of his, boldness, was actually pretty dismayed at the fact of not having solutions, because people that had been vaccinated more than once, or were basically producing spike proteins in numbers, and they don't know how to shut it down yet. So a lot of people are walking around with brain fog and all of these long haul COVID scenarios, and some also from just getting COVID multiple times. But the spike protein is just very, very hard on the system. So there's going to be a lot of people here listening, wondering, am I one of those people? Because it's still not really even recognized when people were injured, spike protein injured. And so every physician at my point, I'm at the point where right now, it doesn't matter what patient comes in, it's one of my first questions. How often have you had COVID? Was it severe? How did you handle it? And then were you vaccinated, and how many times? We have to know that almost as an initial starting point. And so Dr. Merrick's, just kind of his demeanor with just going through it was pretty staggering for me. And there was some other just beneficial stuff that came to be through that, but it just showed you how much he cared, and just how potentially catastrophic this is for a lot of people. So we're seeing a lot of that. What about yourself, Richelle? What was one of your main takeaways?
Yeah, a few things. Let me kind of jump off of what you were saying a little bit. I've seen Dr. Merrick speak quite a few times, and I agree with you. There was a bit of a different affect and a tone that he had than other seasons prior. But, I think a lot of where that chagrin is coming from was from that Yale study that was recently released that showed that, spike protein is being made up to 709 days in the bloodstream of people who are post-shot 1, shot 2. And there was actually, I didn't know this is why we go to conferences, because we get the inside scoop. They said that they had one lady who was, disqualified from that trial, but on a technical error or something very minor, very astute, very non-significant to some degree, but that she was still making spike protein up to 1,400 days. And we're talking, that's another 2 years. So 2 years, just 4 years total, which I thought was fascinating, but certainly made sense to me given the symptoms that we're seeing with people who come in and have systemic problems that are not well explained elsewise by other conditions. So this conference to me focused a little less on the medical interventions, because we don't have the answers to some degree. Because the whole premise of thought, when you get a spike antibody level, if people don't know or they're not aware, it comes from your bloodstream. We're looking at your IgGs, which is the type of antibody that you produce in response to a COVID infection or an injection. In this case, in the injections, and just from clinical observation, Bryanna, maybe you've seen this, you can speak to it, Dr. Troy, you too, but I don't see people who have IgGs to the spike protein that have been mRNA vaccinated. So Pfizer, Moderna in the US, we're talking about. I classically see them in the 10,000s plus. The reference range is 0 to 25,000 plus. I've had quite a few that are 25,000 plus. For J&J, I kind of see people in the 5,000 range or less. And then for natural immunity, it is most common to have your antibodies be 1,500 or less. And Dr. McCullough actually came out with a paper that was published about that too, his reference ranges, and it corroborates what we've been thinking and seeing in the weeds. So they talked a little bit about that, but what I want people to know about IMA in particular is that these are not just people who are making up theories. These are not just people who are, the next, what do we call it? Not controversial. What am I looking for? Conspiracy theories. Yeah. These are highly pedigreed physicians. For example, Dr. Joseph Verone, for 2.5 years, he worked every day during the COVID crisis in the ICU and would accept transfers so that people could get IV vitamin C, they could get ivermectin, they could get high-dose steroids. Dr. Merrick has done this extensive body of research on how to treat cancer. And who's the one that I'm missing? You guys help me out. That developed the sepsis protocols in the hospital. It's the guy who's not here on this. He used to be a part of it. What is it? Pierre Corey. It's Corey.
Pierre Corey. Yeah. Dr. Corey. Yeah.
So you see Dr. Ryan Cole up there. He's a pathologist. He's developed, we got to talk to him outside. He's developed tumor staining, tissue staining, I should say, not tumor staining, to prove that vaccine antigen has been deposited in organs and such. Dr. Robert Malone, he's credited as the father of the mRNA technology. These are highly pedigreed individuals, well above my capacity and caliber, who are banding together to change the way we do medicine. because we've realized that at the core, the foundations are cracked. And so there was very much a public health policy angle, like Bryanna said, because we do have to do a systemic overhaul. And one of the things that they said in that systemic overhaul that they're projecting is, changing the way med school happens. And they want to open up a med school that's functional and traditional medicine and honest medicine certified.
I want you to repeat that again, because what you just said, I want you to the people to really hear this. They're going to start a new medical school. That is honest medicine with functional medicine, traditional medicine.
Correct. It is research-based, but not pharmaceutically profited.
Yes.
Right. There's a big difference. And Bryanna, maybe you can talk about this a little bit, because the other thing that one of the first steps that's been born of this IMA in the ability to get to that goal, right, where we have the med school. And then they even said, well, why not a PA school? Why not a nurse practitioner school? And I said, sign me up. But is that they started what's an independent medical journal, which is very important for the foundations to get honest, ethical medicine out there. Because right now, a lot of medical journals are captured. Dr. Troy has it. And side note, everybody, Bryanna is featured in there. She had her sign my copy because it is Journal 1, Volume 1, and she's a cornerstone, groundbreaking. She wrote some case studies with Dr. J.P. Salibi on amylaminox. Do I say that right, by the way? I think I put an extra vowel in the middle.
Amlexinox.
I like it my way. Just kidding. But it's amlexinox. I'm sorry.
Yeah, I think I've heard it pronounced probably 15 different ways now. Sure. So, it's like when someone just says your name a little different, you just still respond to it. That's where I'm at with amlexinox right now.
That's very appropriate. Well, they've started this journal. Bryanna has written in it. I'd love her to talk to us a little bit about that. But just to give people an idea and a little bit of some excitement about where healthcare is going, this is a well-pedigreed board of physicians. Naturopaths are in there too. Dr. Troy, we need a chiropractor in there. I'm not sure.
I know. Yes.
Yeah. We have Bryanna in the, so they're doing the most with the connections they have, the honesty that they have, the research that they've aggregated. And they're really trying to push in a season where we have momentum, the re-foundationing of medicine. And I think that's really, really exciting. So I'll stop there.
Yeah, they spoke quite a bit about politics, like you're saying, Bryanna, and I think it's because they really, a lot of the doctors there were doctors who were involved with policy, recognized that the level of, I don't even want to say corruption, but it's basically mismanaged. Some of it's corruption, but it's also a bigger system where there's a breaking down of that system, and so they see an 18-month window of opportunity here to make real solid change, to get good people, good doctors that are there to get the patients better and to look at good science, to get them in place of decision making. And that is not an opportunity we're going to get again in our lifetime, I don't believe. And that was kind of like what they were saying. So I was actually quite surprised at the level of politics that they were speaking of. But then when I got to speak with some of them afterwards, I realized the challenge we are up against because of the bureaucracy that we're up against. And so one of the stories that kind of rang true to that statement was just hearing about how Dr. Atlas had 15 minutes to basically state his case in front of President Trump for Trump 1.0. And Trump was listening to a bunch of different people. And he had basically 15 minutes to make it so airtight that he heard the right, accurate information and made the right choice, in our opinion, made the right choice and went with stopping a program that would have been harmful and a little more detrimental. But that's even RFK. They were talking about RFK and how he has to really bring all of his data, and people are like, why aren't they making changes and why aren't they doing this? And there is a machine that you kind of have to work within and clean up at the same time. And so it's quite phenomenal what's happening, but these brilliant doctors and policymakers are stepping into new roles here, and they're creating an environment for people like us to be able to actually work and help people. We're kind of like the foot soldiers, and they're the generals there at the top. And speaking of foot soldiers, I just want to say this because this is one of my favorite moments. When we were around the table just talking about stuff, and we were talking about one of our complex patients, as soon as we started getting into more and more complexities, Bryanna just leaned in. She just, you could tell she was all about figuring this out. And that's when I think I even said, I think you're one of us. You just lean in, and that's what we're looking for. So I love that you're a problem solver. I love that these challenges, that's what this problem has actually attracted, people who are open to figuring things out and problem solve. It's a little bit like flying an airplane as you're building it, but there's a lot of comfort when you're surrounding yourself with people that are really like-minded, but actually elite at what they do. So I like that you're a leaner inner.
I like that there's actually a term for it.
Well, we just made it up.
Yeah, I just wanted to piggyback on what you guys both said. When you guys were both talking, there was something that came to my mind. Is the IMA, formerly FLCCC, to my knowledge, has always had this tagline of honest medicine. When I see that, and I have the comfortability to be able to literally lean in, I guess, to, colleagues like yourselves, it makes my job a lot easier to do because I have these resources so close to me that I can lean on and who desire partnership in the way that we approach our patients. But also, I'm a compounding pharmacist. Compounding pharmacy routinely gets attacked because the powers that be see us as a threat, which is kind of a joke to me because, we're just the small guys, what are we going to do? But we get to help so many people. So we rely a lot on our patients and the general public to help us make these appropriate shifts for lasting change. It's a paradigm shift, a shift in understanding. Several times, even before my time, certain compounds like estrogen and some of these big players in the space were threatened because the FDA, for example, who has some regulation over compounding pharmacies, not to get into all the legalities of it, but they do dictate to some extent what we can do. And so it's important that we allow our patients' voices to be heard, that they're, signing off bills or information to be sent, again, up the ladder so that these people making the decisions for healthcare understand, or at least can catch wind of what our patients are experiencing, what has been literally life-saving for our patients, and how those things cannot go away. We have to retain access to them because it's life or death for a lot of people.
And can I just say, coming from like a industrial medicine complex, right? It was hospital-based. I never used a compounding pharmacy, ever, not once. And I didn't know about them until, I went out into private practice. And I swear they are my secret weapon. They are liquid gold. I cannot live without them. The functional range of ways that you are able to apply, normal medications and then repurpose pharmaceuticals to unique individual situations is just, it changes the game for patient care. For example, and I haven't done this with you, Bryanna, but I never knew you could compound metformin into a cream to bypass a little bit of that GI system issue for some people. It's always been a pill form for me, and diarrhea is just expected for the first few weeks, But that changes outcomes for people. It's a quality of life difference. Or, for example, just simple thyroid medication, desiccated thyroid compound that you can separate the elements and you can raise one and not the other. You don't just have to take generics all the time. Hormones, they're so custom, in the form of delivery and the base of the cream. If you're using a cream to, maybe a vaginal suppository versus a sublingual troche, there's just so much that you can do creatively and uniquely to solve so many other solutions that just, and not against normal pharmacies, but normal pharmacies don't offer. And it really is just liquid gold for me personally as a prescriber.
Yeah, I've heard Richelle say she's had to reach out to you. I'm going to have her go into a little bit more detail on that. But for our listeners that really don't know the difference between a traditional pharmacist and a compounding pharmacist, what would you say is the biggest difference? How are you different than a traditional pharmacist?
So as far as the pharmacy goes, when you drive by these independent or small pharmacies that you would call mom and pop, they're not always compounding, but usually they're, privately owned. And a lot of them have those manufactured pills in all the bottles on the shelves that you see when you go back and you get counseled by the pharmacist. The compounding pharmacy or pharmacist role is to customize and personalize the medication experience for the patient so that they can tolerate a medication that otherwise may give them diarrhea, that they may have a reaction to the inactive ingredient. So back in the day when you used to see in the movies, I guess, someone grinding up stuff behind the counter. Yeah. That's how compounding pharmacy started, and that's how we do it. But we've up leveled quite a bit since then. And so we have the opportunity to customize doses, to circumvent drug allergies for patients, to find a way to get the prescription in the patient that is an alternative to what's already available. So we cannot copycat or make a copycat version of what is commercially available. When I say commercially available, I'm talking about that pill bottle that gets delivered to, like a CVS pharmacy or Walgreens or something like that, for example. So we're usually putting it in a different dosage form to customize it for the patient. Customization is the name of the game for us.
Yeah, and just especially with the hormone stuff, because even back in my early career, we would always recommend compounding pharmacies for the hormones, and just the difference we see with our patients was pretty staggering. Now Richelle has completely taken that over, so in a good way. So what are some of the specialties or some of the things you're seeing as far as need? And I'll start with you again, Bryanna, and then Richelle, just some of the stuff that you're relying heavily on Bryanna for when it comes to some of the tougher patients.
Well, if I can just for a few minutes discuss one of my favorite topics, but it's really relevant here, is mast cell activation syndrome.
Oh yeah.
This is my baby. I have a couple babies. This is my big baby. And this was news to me. I had never even, I'm sure I learned about a mast cell at some point along the line, but I couldn't tell you what it was until probably 2022. And mast cell activation syndrome, or MCAS for short, is basically a collection of symptoms that is just wild.
Yeah, this is a wild child. This is not a baby. This is a wild child.
This is a toddler with an attitude.
Yes.
And so, it was probably 2022, something like that, where I kept hearing repeated complaints from patients, as in chief complaints on the phone from patients. And in addition to trying to bounce back from a pandemic and just how that shook us up in total, people just weren't getting well, and they were showing up with some wild symptoms that, to be quite honest, when you hear it for the first time, you're thinking, I'm not so sure I believe that, not out of disrespect. It's just difficult to believe all of the symptoms that these people have. So I'm talking about sensitivity to the sun. I'm talking about only being able to tolerate 5 or 6 foods max. I'm talking about taking one pill and the person bloats up like they're 5 or 6 months pregnant. And I quote from them, can't tolerate water, can't walk into a building because of the Wi-Fi, the EMF, right? So these people are highly sensitive across the board. So what does that tell me? There's some sort of multi-system involvement. Something is connecting all these symptoms. And it turns out that in a lot of patients, that's the mast cell. So the mast cell is just a type of white blood cell. It's an immune cell. But the thing that's special about it is it's present everywhere. And it's densely involved in the function of the central nervous system. So the brain, that's why we think about the brain fog. It, as we learned at the IMA conference, also gets lodged in every organ, every type of tissue. So there's liver issues happening. How many patients do we see with neuropathy? So many. And this has been a major attack on the central nervous system, decreasing the functionality of the nerves and causing a lot of pain, causing issues with the cardiovascular system, embedding in the heart, all these things that when those mast cells get aggravated, I say that they basically are circulating around the body asking one question all the time: am I safe? And if the answer to that is no, then they start going on the defense. And that's good until it's not, because I see people are not able to shut down that reaction process, and that's why they're reactive to everything. So I think one of the most amazing things that we've been able to do over the past few years is build up a large repository of medications on our formulary to help patients with MCAS. But one of the important things there from a compounding pharmacist perspective is we really have to watch the inactive ingredients that go in the medication. It's very common to hear these patients say, oh, I'm having an allergic reaction, because remember, they react to everything, but I can't take over the counter Benadryl because they can't handle the dye. So we can make that Benadryl, 1 in a different dose, 2 in a different dosage form like a capsule, and then put a very inert or mild inactive filler in there like baking soda, for example, which MCAS patients do great with. It doesn't bother them at all. So that's just one example of how we can change what's commercially available to something that is more tolerable. We have also been a big player, in my opinion, in the repurposed drug space. So ivermectin has been a hot one for us, and we have seen some amazing results for patients in the way that their skin clears up and their inflammation, and they seem to have spontaneous resolution of this inflammation that they've had for so many years, right? But we know that it has really good anti-inflammatory benefits, so that's part of it. We have a lot of patients that are finding that they have parasitic involvement, the development of cancer. I mean, the list goes on and on and on, but I really am hyper-focused on the mast cells because they interplay with so many systems. So whether we are talking about cancer or parasites or any of these things, those mast cells are overreacting. So we've been able to come in with a lot of compounds like VM-Lexinox, low-dose naltrexone, mebendazole, right, which are all really helpful for these patients, not just for symptom resolution, but for getting them over the hump.
Well, and historically, we've never needed medications to actually manage a histamine intolerance, histamine overreaction. We just haven't. We've been able to do it by improving sleep and digestive function, and things would be okay until COVID. Then all of a sudden, we've had to go to stronger medications versus the herbals and some of the other treatments we're using. And some of the things, I know Richelle and I both had an aha during this event when it came to histamine in particular and mast cell, but I want people to really know this. When you go through any type of inflammatory condition like we have with recently, and all the environmental chemicals now become a potential trigger for these mast cells, one of the things that we have found is that people, every time they're in what we call fight or flight, the release of adrenaline will actually trigger the macrophages to release the histamine. So not only are the mast cells all over our body in different areas, but adrenaline and circulating adrenaline will actually trigger a heightened response or release of it. And you said it's like it goes on a defense. I tell my patients it's like a skunk and it starts spraying. And you know, if it doesn't shut down, you're gonna have consequences. And so we're seeing a lot more of that. And we have just seen in the last 5 years in particular, more people walking around in a fight or flight state. And so they're in what we call sympathetic dominance. So their nervous system is actively triggering the histamine release all the time. And so we have to, in concert, get the mechanisms to shut down, get them out of fight or flight while managing their symptoms. And like you were saying, we've had some pretty good breakthroughs with really complex patients who have only been able to eat 3 foods. And one of my favorite patients, I'm going to get her on the podcast here. She's very optimistic with her demise, I'll say, when it comes to just how her body is. But she was able to keep working, but she was working out too much. She was actually releasing adrenaline during the workout. We had to decrease the intensity of her workouts to just reduce her load. And then we started implementing these layers. And that's what we've had to do. Nothing is a standalone at this point. It's been layered therapies when it comes to nutrition, sleep, exercise, stress management. We've had to bring on a trauma nurse here at Synapse, not ER trauma, emotional trauma. She manages that system. And so we've had to onboard the pharmaceuticals and to get the results, to get people better. So I think that, and you guys correct me if I'm wrong on this, but I think right now is the most I've ever seen as far as histamine and mast cell disorders. I think COVID and the vaccine program just induced a massive dysregulation of our immune system response. And so now people are reacting to the world, to their environment.
Well, and I'll say this too. So it's interesting because I've walked with FLCCC from a protocol perspective ever since they first started launching, their tools and their research and such. And there's been evolutions in the way that they treat long haul COVID and, vaccine injured individuals. And right now, one of the top categories of treatment pathways is to stabilize mast cells. That wasn't what it was in the beginning because I just don't think we knew enough at that time. And to Bryanna's point, mast cell activation syndrome is something that does not necessarily walk like a duck, talk like a duck, and quack like a duck. It is something that is very, very individualized to each person. And so it's hard to capture as a clinician because you think in different categories and different symptoms, and then you don't think as a constellation of symptoms. And so that's why it's so important, I think, for people who are experiencing things like this mast cell activation syndrome to work with clinicians who have a multifaceted approach, because not one thing will work for everyone. I had a patient, it was I think one of the second patients I'd ever had when I was green into trying to treat people with long haul COVID and vaccine injury syndromes. And I could have just pulled my hair out. I was like, I don't understand what is going on. And I was so frustrated on behalf of myself for her because I wanted to help, right? Until it hit me and mast cell activation syndrome was kind of coming out. And I might have even just had talked with you about it, Bryanna. And I thought, you know what, let's just treat in this way. We tried a histamine. This is the other thing about mast cell activation syndrome. Classically, we've relied on blood work like histamine levels and tryptase levels, for example, to find it and to say, okay, there's the expression of what those mast cells are dumping. But in these long haul COVID syndromes, and unless you're hyperacute in an exact flare, we're not capturing that on blood work. So it is a diagnosis that you don't have to prove with the blood work, but it is something that classically used to be prior to this season that we're in, I believe. So for example, this lady didn't have any of that classical blood work to prove it, but I said on premise of thought, we're going to try this. And she was a brand new woman on low-dose naltrexone alone. I mean, she was able to be with her grandkids again, fly again, take walks again. She was a heat sensitive person because of the mast cells. She couldn't be out in the sun. And God bless it, we lived in Oklahoma at that time. So sun is very relevant to her day to day. And it flipped the entire switch for her. I mean, even her mood was balanced. Her periods were regular. We haven't talked about that as females. There can be cyclical, changes and flares with it during your cycle. So mast cell activation does not walk like a duck, talk like a duck, speak like a duck. You really have to be trained in its constellation of symptoms. And other places it lives is the skin. So rashes can be kind of hyperflaring and common. Your gut system and then your lung system. And I think the other three predominant areas that I see things beyond the neurological system. What we didn't talk about too, though, was I didn't know, and Troy, I don't think you knew either, was that these mast cells exist in the venous system. I had no idea about that. I still need to look at the research about that, to be very frank. But that was something new to me. And, that Dr. What do I say, Vaughn? It wasn't Vaughn. Vaughn.
It was Dr. Vaughn, yeah.
Dr. Vaughn is urgent care, I believe. Primarily, he has a network of urgent cares in Alabama, but he kind of just dug right into the vascular injury that was happening post-COVID infection and injection, and started treating people and actually taking blood under a microscope and looking for these microclots that you can't see on a macro level or capture with standard blood tests that we have, and started treating people with that. And in the evolution of his research, he has come to find the mast cells, which we all believe as a post-COVID sequela can be very common, have a predominance in this venous system network that he's now looking into. And interestingly enough, that venous system mast cell network doesn't communicate well, is what I understood. Is that correct? With the bloodstream flow, and that's because of damage in the actual venous vessel with something called vasa vasorum, which is the vein's own blood pool supply to the vein to let that smooth muscle cell work in the vein and maintain its turgor and its compression.
So let me translate for people for that, because you said it brilliantly. What you're basically saying is you're swelling on the inside. So people will feel the swelling on the inside. It'll be a mast cell scenario, but your tryptase won't go up in your blood work.
Right.
It's not getting into the blood. So the traditional blood work for mast cell doesn't necessarily show when it's a venous problem. And that was new to me too.
Right.
So yeah, I did a deep dive when I got back. I'm still in the midst of it, but the amount of mast cells on the outside of the venous system within that its own circulatory pool is very, very significant.
Mm-hmm.
And right away, I had about 5 or 6 patients where I wrote their names down because I suspected a challenge there. So that for me, that was one of the highlights actually to learn that at the seminar, and to hear just the mechanism that mechanism existed, because it explained a lot of the patients what they were telling me, but I didn't have a physiologic mechanism to be able to relay it. I thought there might have been a lymph component here involved, and we've seen the dysregulation with the memory T cells and things like that. So I was looking at all these other potential pathways, and that came out of left field for me, but it made so much sense.
Yeah, it very much did. It's really interesting to see the genius of people come together, to be honest. Because we're going to need people like Bryanna to help us stabilize those cells if we can. We're going to need people like Troy to explain it to us, because we need the principles of the physiology. And then people like myself to go capture it, go find who's who, right? And bring them to the team to get well.
I'm here to let you guys talk and then translate it and dumb it down. So I'm here.
Is my California accent that strong?
No, it's the multi-syllabic word that you keep using. It's that high level of intelligence.
Sure. Well, do we want to go in, Dr. Troy? I was going to say to maybe some of Bryanna's independent work too, as a pharmacogenomicist. Or Bryanna, do you want to talk to us a little bit about what you wrote in the journal with the IMA? I'd love to either topic move into that.
Yeah. We can hit both. They interplay, right? Yeah. So completely separate of the pharmacy, I have my own genetics testing that I do, which is nutrigenomics testing and then pharmacogenomics testing. So, these multi-syllabic words again, but basically genomics is genetics, it's DNA, it's genes, they all mean the exact same thing. Nutrigenomics is looking at how the DNA impacts how we pull nutrition from our foods or from vitamin and mineral supplementation. Pharmacogenomics is looking at how the DNA impacts how we metabolize drugs, period. So it's really very simple, but this is not new information. It's just not integrated into most people's practices. And so I'm glad you brought up histamine, Troy, because one of the primary offenders that I see for kiddos and adults alike is histamine intolerance. And so we see a lot of eczema. We see a lot of disrupted sleep. We see a lot of skin issues in general, trouble breathing, because this is where the mast cells are so dense. And what we didn't talk about is that one of the main contents inside of the mast cells, because the mast cells are like a house for a bunch of different things, is when they get activated, they spill out, or they skunk spray histamine everywhere. Right. And so then they start having a lot of problems, because histamine wakes up the central nervous system. It keeps us awake. It keeps us alert. It keeps us attentive. But we don't want that when we're trying to fall asleep. No. So when I do nutrigenomics testing, let's say, for example, for somebody, a large part of that is the food evaluation. And so I match up their symptoms that they're describing to me along with the results of their genetic tests to help map out which foods they should limit and avoid. And a lot of times that's high histamine foods. So we're talking about strawberries, bananas, spinach is probably the biggest offender. People think they're doing a good thing by throwing it in their morning smoothie. And we know spinach is healthy, but not only if you're putting it in your body, but you're blending it up and you're releasing all that histamine, that's not going to be good. So we have that conversation. We talk about limiting cooking in a crock pot, limiting eating meats that have been smoked for a long time, leftovers, which can be tough because you got to meet these people where they're at with their lifestyle. And that's tough for the food preppers.
That's a tough one. Even things like leftover red meat. Red meat has very little on the histamine, but leftover, it starts to accumulate. So tricky things like that, man, that's not fair.
You guys have just cut out my breakfast and my dinner.
Gotta go back to the grocery store and try again. Yeah, so it's neat to help uncover what people have, I think, been questioning for a really long time is why do they have such a hard time healing? So when I can work with you guys and we can tag team these patients to give them more information, equip them with information, and help them heal, it's very interesting to see them take ownership because they're seeing their DNA information on the paper, like, okay, that's me. I can do this. I can heal. But I think it's also important to ask our patients if they believe if they can heal, because these are usually really, really sick people by the time that they end up with us. And it's important to me that they do believe that, because I can support them better and I can get behind their version of healing, which is going to look much different than the idea for healing that I might have for them. One thing that I use that we talked about in the journal is Amlexinox. And so that is something that we compound at Physician's Preference Pharmacy down here in Houston. And we were approached by Dr. Yusuf Salibi a couple of years ago, who is very instrumental in the IMA, if we would compound this. And he said, I want to use it for mast cell activation syndrome. I said, okay, well, let's give it a shot and see. This seems like it's been like a magic bullet for people. And not that we want to overpromise, but what I explain to people is you're expected to feel better on the Amlexinox because it helps to calm down the mast cells. So when somebody takes it, they say, oh my gosh, my brain fog has cleared and my digestion is better and my skin is better. It's not that it's a wonder drug. It's a drug that's working everywhere on the cells that are located everywhere. So we published some case studies in here of there's one that I'll specifically share with you. A lady that came to me when I first kind of intercepted her case, talked to her on the phone. She was on, I think it was 85 different medications and supplements combined. I had to type out her list and then I had to tape the 8.5 by 11. So I had it all in front of me together. And then I did my med rec on it and went through everything, to make sure that we were not duplicating anything, what we could take away. Finally, she got to the point where we introduced Amlexinox for her. And after just about a month, we were able to take about 70 medications and supplements off of her regimen.
Wow.
So that's what we call polypharmacy, right? In our world, it just means a lot of stuff, way too much stuff. And at the end of the day, that all has to go through the liver, has to go somewhere. So any opportunity that we have to reduce polypharmacy and take that pill burden off the patient is a great thing. Not to mention it's going to save them a lot of money. So I love to see how this all interconnects, right? But being able to peel people off of all these meds, I mean, that's the deprescribing habit. That's how we also instill faith back in pharmacists.
I agree.
We also want to pull you off meds too, because that's an important part of what we should be doing.
I have a question for you. How long did that take you, number one, and was a spreadsheet involved?
I am not an Excel girl, but I am a Word girl. So I typed it all out. It took me several hours because a lot of these too, usually what I find is those that have very extensive med or supplement lists like that, they use all kinds of different brands that I've never heard of. So I had to go and Google every brand, see what was in everyone. And then they usually go after the combo products that have about 40 ingredients in each product. So
several hours is pretty good. That would have taken me 3 days.
Yeah. It was wild, but she's doing so well, and her positivity and desire for healing plays a big part in that. So that's how I learn from my patients. I'm so encouraged by them. I actually, whenever I get an email about how well they're doing, I print it out and I have a folder in my desk because it reminds me of why I do what I do.
Yeah.
It's a beautiful thing to watch people's transformation and healing.
Yeah, we need that. So if any of us have ever impacted you, just send those little notes, because a lot of times we're so focused on the people that we haven't been able to help yet that it sure is nice to get those messages. So don't be afraid to send those in.
Tell people from like a Synapse perspective where Bryanna comes in, are, not if you're just a difficult case. I don't want to put that. It's if you just have the curiosity of what's going to work best for me and my body. She's easily accessible. Where we have, what's neat is she and I have been in collaboration with each other now for maybe 2+ years. And so with the patient's consent, Bryanna and I talk back and forth after she gets her data. She makes a full visited plan for you. It's usually a buccal swab, like a cheek swab, right, Bryanna? So it's not invasive testing. And she sits down and she goes over your results with you thoroughly. Like she just said, she spent 3 hours on just the medication list alone. So for Bryanna, working with you has just been worth all of its gold. And I want to say thank you from the bottom of my heart, because people feel very listened to, taken care of, and integrated in their health, because you are able to find things that we scientifically can guess at. Sometimes we say science is the guessing game, but Bryanna can get to the nitty gritty and astutely say, yes, this medication you're metabolizing well, and we should actually lean into it, versus that one not really doing you a lick of good, and your methylation pattern's off, or your autophagy system's not doing so great. So let's put some intermittent fasting into this. Maybe we can get you off of a few more supplements and meds. That's what Bryanna is very, very highly valuable for.
I appreciate that. I just wanted to say one more thing, actually, if I can, on the genetic testing, is when we talked about metabolic dysfunction at the beginning, that is a whole bear on its own. But one of the main things that happens, I like the way you said it, injected or infected, is that the mitochondrial function in the cell gets very, very hijacked. So the mitochondria basically should help us make energy and oxygen. So when people are showing up with a primary complaint of fatigue, it's very likely that their mitochondria have been affected in one way or another. Now, genetic testing that I provide, you do it once. Because if you test now or in 10 years, your result's going to be exactly the same. Your DNA is your DNA. But some of these changes that the environment will induce, or having an infection or injection, can change the way that the body is responding. So there's usually two systems that I see in those people that show up to me the most sick and have been the most affected is their cellular autophagy portion of this test, which is their cell's ability to detox. Bad. It's bad. Inflammatory profile, bad. But the good news is, because our DNA is our DNA, we can't change that. But what we can do is we can use lifestyle changes, we can use vitamins and minerals, and we can use pharmaceutical drugs, and usually in that order, food also coming first, to support the DNA so that it can handle the brunt of these environmental changes.
That's good.
So I just want to say that, because it's not that you're doomed, right? It's just we're equipped with information, so then we know what to do about it.
Yeah.
Yeah, on that note, with the metabolic dysfunction and the protection of the mitochondria, that was the other part. We don't have time this time to tackle it, but when they spoke about the cancers that are starting to occur because of this, I just want to highlight one of the other books that I pulled up was the Cancer Care book by Dr. Merrick, The Role of Repurposed Drugs and Metabolic Interventions in Treating Cancer. And the discussion around cancer was fascinating as well. And I personally feel like we're going to have so many breakthroughs that come from this in the upcoming years surrounding cancer, because we're seeing a lot of mitochondrial compromise right now. We're seeing a lot of metabolic dysfunction, and the consequences are, chronic fatigue, like you said, or fatigue and other systems shutting down depending on the organ system. But they protect your DNA. And so just getting on top of that now can be very proactive at prevention of cancer. And they declared at this seminar too, that was one of their goals, is to start getting ahead of cancer. I never thought I would hear that at a medical conference, and that in functional medicine, that's our world. That's what we want to do, is get ahead of things, look for dysfunction and a breakdown in communication, mentally, chemically, and physically, and get ahead of it. Proactive healthcare. It was music to my ears. It was so good.
Yeah, it really comes down to cellular health in a lot of people, right? Whether that's whether you detox well, or whether that's where you need to boost your immune system. I think we're all uniquely equipped to be able to diagnose those pain points for you if you're somebody who is either struggling or you just are science curious about your own health and you want to protect yourself long term. And it's very important, I think, in this day and age, to align yourself with providers who know about those conversations and who are actively and proactively searching for solutions to those situations.
Yeah, it really helps with quality of life. One of my mentors said it this way. He said, "We are living too short and dying too long." Coupling what you guys do when it comes to just the metabolic health, when it comes to the genetic component, and being able to manage it, whether you're given repurposed drugs or compounded drugs or being taken off of them. And Richelle, I've seen the work you've done with patients as far as finding the little thing that's going to make a difference. Our team relies on, I'll say it this way, we have team meetings every single morning, and there's days where Richelle is not as part of the team meeting because you're not working that day. And always I hear the words, "Well, what would Richelle say?"
Oh, that's I didn't know that.
What does Richelle think about this?
You guys are kind.
And so yeah, the combination anyway is getting it's really exciting to be seeing some of the outcomes, and we're really talking about quality of life for a lot of people. We may not have answers for the really severely injured people yet, but we do have a lot to offer for the quality of life to enhance, at least keep them afloat until we do have more permanent solutions. But just know that there are, number one, a lot of good people working behind the scenes and working within our group here and around the country, really. And number two, we're about to have a new healthcare system.
Yeah.
We are in exciting times where we're birthing something very, very new that really is choosing people over profit. So I'm pretty excited about that.
Yeah. And I'll just say it's never too late to be proactive about your health.
Never too late.
Never too late.
No.
So I just always encourage people. I've even thought I need to see Bryanna myself.
Yes. Yeah.
Indeed, I will still be here.
Yes.
I'll be a referral for my own self. You're coming away.
Yeah, well, I appreciate what you guys are doing and how you also, Troy, have opened up this platform and to have this conversation. And we're all learning in this together. And we learn so much from each other and from our patients. So thank you for what you're doing, Richelle. Thank you for being the Nancy Drew that you are, and always thinking about what other people don't think about, because I know I appreciate you for that reason. I know your patients do too.
Thank you.
Well, thank you both. Well, we'll if you have any questions or anything, just reach out. We've got your information down there. Bryanna, I know we'll be doing this again in a different light, different topic probably. And just share a lot of the breakthroughs and a lot of the information we've had. So thank you both for joining me, and to all the listeners, thank you for listening, and continue to send in your requests on different podcast topics that you want us to talk about. We'll be bringing Bryanna back, I know for sure.
Look forward to it. Thanks, Troy.
Thank you for listening to the Synapse Snips podcast. If you like what you heard, subscribe to the podcast and share the podcast. To learn more, check out our website at www.officialsynapse.com. Until next time, this has been Synapse Snips podcast. We'll see you on the next episode. This podcast is for information purposes only and should under no circumstances be considered medical advice or a substitute for medical care. Any information given in this podcast is not intended to diagnose or treat any disease and is at the user's own risk. Please first consult a licensed healthcare professional.